Caring Unveiled with Jarrett.
Welcome to Caring Unveiled, a quarterly program brought to you by Memorial Health Foundation. This series is our way of connecting with you and offering a behind-the-scenes look at the compassionate care being delivered across our region. In each episode, we'll introduce you to the dedicated team members who serve our communities, highlight the life-changing services available close to home, and shine a light on the mission-driven work happening every day at Memorial Health System. We're thrilled to have you join us for this episode. Joining me today are some of our social workers from the Cancer Center located on our Belpre Medical Campus. We're excited to highlight the work of our social workers and case managers that they perform every day and remind you of the services we provide to the community. Joining us for our first segment today is Kim Cooper, social worker here at the Cancer Center. Kim, thank you for joining us.
No problem. Happy to be here.
Great. Do you want to share a little bit with us about how long you've been with the health system and your role here now?
Yes, sure. So I actually have been with the health system for 25 and a half years. And prior to that, I was an inpatient social worker throughout the hospital. Basically, I worked on every unit. So I have a lot of experience all over the health system.
Can you talk to our viewers about what that means and what they can expect?
Here at the health system, psychosocial services are given to everyone across the whole healthcare system. Of course, here at the Cancer Center, we do have a more concentrated role in what the needs may be, but across the system, we're always assessing and providing resources. We can address psychological, emotional, social, spiritual, and just general issues that folks are having.
Will you talk a little bit about take us through what maybe the first time they're meeting with you, what that might be like?
So the social worker will meet with a patient usually at one of their appointments, whether that be a treatment appointment or a consult with a physician, to gather that information about what their life looks like. And we just are able to take all that information and then develop a plan of how we can best help you.
Well, I know because we hear from our patients how much they appreciate our social workers when they've met with them and how much they have helped when we get to speak with them at the foundation and they talk about this programs that you connected them with. It's just, in many cases, taking a really bad time of their life and helping make it better. And you all do such a great job with that.
Thank you. No matter where you are in the system, we can help to assess if you have psychosocial needs. We can hook you up with a counselor or a mental health provider. We assist with advanced directives and other healthcare decision making. If you are having financial issues, we have lots of resources we can connect you with. Transportation issues, end-of-life issues. So if you're having spiritual concerns, we can assess and help make appropriate referrals. We want to connect with any patient in the whole health system who would have a need, regardless of their financial status. If you are experiencing a hurdle, a new diagnosis is something that anyone has trouble with. So we want to be able to be a sounding board and a help for any patient, regardless of your financial status.
Well, thank you, Kim, for being here. I know you talked some about the resources. When we come back, we're going to be talking with Susan Bhati about the Dr. Kim and Jackie Poole Resource Center. We're back this segment with Susan Bhati, social worker here at the Cancer Center. Welcome, Susan.
Thank you. Thanks for having me.
Absolutely. Do you want to tell everyone a little bit about how long you've been with the Cancer Center and your role here?
Yeah, I started as a part-time social worker, and I came in during COVID time. So that was an interesting time. But I've been here for now 5 years. So yes, it's been a great experience, and we've really grown.
And we are sitting here today in the Dr. Kim and Jackie Poole Resource Center, which is part of this new facility that opened in 2021. They wanted to do something great for this community, and we're so excited about the Cancer Center opening. Do you want to talk to us a little bit about what patients experience when they come to the Resource Center?
We provide hats, wigs, and scarves, and we have some prosthesis and bras. These are all provided by donations from the community, and also we purchase them through our Memorial Health Foundation. So patients can come in at any time. We're open from 8 to 4. We have a staff person here, and then if she's not here, we have the social workers here can help any of the patients that come in. We also have educational materials. Patients can come in and read our materials. They can sit here and look through their disease-focused educational materials. And then we fit patients with wigs. So we provide all those services free of charge. And we want patients to come as much as they can because we know it makes them feel good. We try to do it so they can feel confident and comfortable throughout the cancer process. And it's also sometimes difficult for patients to buy the wigs, or they can be expensive.
And you mentioned the hats. I know we have community members that hand crochet a lot of the hats here to donate. That we live in such a generous community.
We do.
All around, and it's fantastic.
We have several organizations and churches that they crochet the hats. They also bring blankets, and then they bring a lot of chemo bags. And so patients really enjoy getting those bags when they first start treatment.
I want to talk some more about the support programs that's offered here. We know we've got the Resource Center, but you all do a lot. There's a lot of other programs that you do.
We have a breast cancer support group. We offer that the third Tuesday of every month from 5 to 6. We offer the general cancer support group, and that is from 1 to 2, and it is the fourth Thursday of every month. And then we have a head and neck support group, and that is quarterly, so those dates change.
Okay.
And then we also have a survivorship series that we're starting soon in March, and there's 3 programs that we'll be having throughout the year. So that's an ongoing program that we provide as a cancer center. We also have a free class that is a makeup class that is more than a makeover. And that is provided by Sharon Shaner of Merrill Norman in Marietta. And our patients can come, and it's a 2-hour class that we offer throughout the year. So the patients really enjoy that class.
Of course. So absolutely. Well, great. Well, Susan, thank you for joining us here today and talking about the Resource Center and the programs that are offered, the support programs that are offered through the Cancer Center. You all do tremendous work. I know our community appreciates it.
Oh, thank you.
I know up next we'll be talking with Jane Skeen about our transportation program. Joining me now is Jane Skeen, a social worker here at the Cancer Center. Jane, welcome.
Well, thank you. Glad to be here.
Jane, tell us a little bit about how long you've been with the Cancer Center and the health system.
Well, I am a licensed social worker, and I've been here for 12 years, exclusively in the Cancer Center.
Oh, that's fantastic. It's rewarding work, I know. Very hard work.
Definitely.
Yes. Well, we know that transportation is a very big barrier in our region and for many of our patients, and that is very much true for our cancer patients. I know you work a lot with our volunteer drivers and our transportation program. Can you tell us more about this program?
We started the volunteer drivers in 2017 exclusively for our cancer patients. We have 5 drivers who are very passionate about driving and making sure that our cancer patients get to their appointments. They volunteer their time. We do pay them mileage through the Cancer Patient Emergency Initiative. Transportation has been a barrier for many, many years, mainly because we have such a large rural area. A lot of our patients are traveling long distances. A lot of them have very limited resources. There's a lot of reasons why a patient might need help with transportation. The cancer patients have lots of appointments. When the providers are ordering their treatments, it may be a daily radiation Monday through Friday, or it may be a weekly chemotherapy, which could be delivered 3 days in a row or several more days in a row. It is best if the patients receive the treatment as the physicians ordered. They will have a much, much better outcome. We do utilize community resources in the area. We do have a great Ohio resource network, especially in Washington County, who help us a lot with the patients. But what we do is we plug those volunteer drivers in when those resources are not available. In West Virginia, it's a little more challenging, especially when you're getting outside of Wood County. West Virginia is a rural area. You get outside of Parkersburg and it gets even more rural, and there's not a whole lot of resources available. As the hospital clinics expand, we are wanting to expand our resources here with our volunteer drivers. So we are always looking for new drivers. And in order to become a driver, you need to go on to our website and apply to be a driver. And Cindy Hall with Volunteer Services will contact the driver and talk about the process. So
at Memorial Health Foundation, transportation is the number one request we get for assistance. We know it's often the number one reason people are having to miss their appointments is due to transportation. And many times we're giving them gas cards. They may have reliable transportation. They just may need $10 or $20 a week to be able to get here, to afford to get to their appointments. And so very small gifts into that program make a huge difference for our patients. And I know you all do a fantastic job in getting them connected to the community resources as well that you talked about. Well, helping support the transportation program as well as the Cancer Patient Emergency Fund is our annual fashion show each year. That's a real fun event for this community. Do you want to talk a little bit about this fashion show?
it is, yes, definitely. It is our largest fundraiser, and we have a lot of fun watching our cancer patients walk down that runway and enjoying themselves and celebrating their bravery for doing that and the struggles that they've had. We just have a ball. So yes,
It raises a lot of funds to go back to help other patients. They're all cancer patients walking down that runway. And my first one attending was, I didn't know what to fully expect, that it was going to be about fashion. It's not about fashion. It's about celebrating those men and women that are doing that to help raise money for other people along that journey.
Yes.
Well, Jane, thank you for all that you do for our patients and our health system. We know that if people listening want to volunteer as a driver, that they can reach us at our website, mhsystem.org, where they can find more information about our volunteer program and go through that process.
Absolutely.
To join you here.
Yes. Great.
Absolutely. Well, thank you, Jane.
Thank you.
Thank you, Kim, Susan, and Jane, for joining us and for the vital work you and your team do to support our patients throughout their care journey. And to our viewers, thank you for your continued support of Memorial Health Foundation. Your generosity expands access to care and strengthens our health system across the region. Be sure to watch for the next edition of Caring Unveiled. If there's something you would like us to feature in a future program, I'd love to hear from you. Until next time, thank you for being a part of our mission.